Good afternoon, and thanks so much for joining in today. As we see states all around us, from California to Oregon to Washington, face catastrophic wildfires with losses of life and of property, I do think how fortunate we are here in Montana. Over this past week, initial attack has been light in our state. We've had 1,876 fires burn over 260,000 acres this wildfire season to date. Estimated state fire suppression costs to date are at around $10 million. It's still significant for communities that have been impacted, or homes that have been lost. But when I think back to the 2017 fire season, where the state costs were about $70 million, to date, we're still in a pretty darn good place. Nationally, though, we do remain at the highest level, preparedness level 5, and are facing a significant shortage of resources, including crews, engines, aircraft, and incident management teams across the West. We continue to maintain our readiness and initial attack capacity here in Montana. At the same time, we've also sent several engines and command vehicles to California through the Emergency Management Assistance Compact, as well as mobilizing several engines to Oregon and Washington. We've also sent human resources, including incident commanders, and several DNRC and local government staff to other states. We want to continue to be able to help our neighbors in need, and in order to do so, we need Montanans to continue to be vigilant and safe. This year, over 75% of wildfires in Montana have been human-caused, and as fall arrives, we're relying on Montanans to do their part to keep fires from starting. Montanans recreating or spending time outdoors are reminded to be careful with activities that could cause a spark, potentially igniting new wildfires. If you're camping or hunting this weekend, please remember to completely extinguish your campfire. And as is apparent to all of us, wildfires across the region are creating unhealthy and smoky conditions here in Montana. Smoke is drifting into communities and rapidly degrading air quality. An air quality alert has been in effect in many of our counties since Sunday morning. Air quality conditions will likely stay the same for the next few days. That is, air quality levels are expected to range from moderate impacts to unhealthy for sensitive groups, with some areas experiencing unhealthy air quality. A strong low pressure system is expected to begin moving in on Friday or Saturday from our west. With fires still burning to our west and southwest, the shift in upper level flow may direct more smoke into Montana. This system may bring some rain, which could help improve air quality, but smoke might not completely clear out. Smoke in the air can cause health issues. Obviously, smoke can irritate your eyes or your respiratory system and worsen chronic heart and lung diseases. Not everyone who's exposed to thick smoke will have health problems. How much and how long you're exposed to the smoke, as well as your age and degree of susceptibility, play a role in determining whether or not you're likely to experience smoke-related health problems. If you're experiencing serious medical problems for any reason, seek medical treatment immediately. Of utmost concern are for older adults, children, women who are pregnant, and people with heart or lung disease, including asthma. These are the most vulnerable to the adverse health effects of air pollution from wildfires. Take common sense to protect yourself during wildfire season. When air quality is at unhealthy or hazardous levels, should consider their health before participating in those outdoor activities. And the best way to protect against the potentially harmful effects of wildfire smoke is to reduce your exposure to that smoke. You can find information on air quality levels in your area at the Today's Air website, which is www.todaysair.mt.gov, as well as provides information on how to stay healthy and protect your lungs during this period of intense smoke. Keeping safe and healthy during these times also means that parents and staff have access to information should there be any cases of COVID-19 at their kids' schools, while also ensuring that privacy is protected. Our schools and local public health they've worked incredibly hard over the months to plan for students' return to classrooms this fall. In addition to our teachers, parents are also navigating new challenges and additional workloads. Parents have spent a great deal of time preparing their kids for in-person learning, and they need to make sure to have the ability to make informed decisions. Last week, we had launched our outbreak response protocols to help guide schools through navigating students with symptoms, testing, and quarantining and isolating. Starting today, the Department of Public Health and Human Services will post once a week some demographic information about positive COVID-19 cases in our K-12 schools and at our universities. It's critically important that we're transparent for teachers, staff, and parents, while at the same time following privacy requirements. My public health team has worked on a way that we can provide parents, teachers, and the interested public with general information if there are positive cases associated with the school. This is a system that protects student data in small schools while also providing a basic level of information and the transparency and the trust that parents in our community need. For schools with over 50 students, both the number of students positive and the number of staff positive will be shared along with the name of the school and in which county the school is in. For schools with between 11 and 50 students, the number of students and staff positive will be shared, but it won't distinguish between our students and our staff. And for schools with 10 or fewer students, there'll be no reporting in order to ensure the protection of individual privacy. The data at the state level will be updated weekly on Wednesdays, or if there's a major event, then the dashboard may be updated to reflect that. The data will be posted on the DPHHS website on their demographics page that shows other information regarding COVID-19, including cases in other congregate care settings, such as nursing homes and assisted living facilities. There's a link to this demographics page on the COVID-19 map at covid19.mt.gov. We expect to get that information up later on today before the end of the business day. As we continue to prioritize making sure that our kids can have their academic, emotional, and nutritional needs met in a school setting, we also continue to work towards shortening testing turnaround times and making sure that Montanans have access to testing for COVID-19. Over the past couple of weeks, the state lab has received an average of 2,800 to 3,200 test samples each day. State lab's priority for testing samples is hospitalized patients, symptomatic individuals, those considered close contact to a known positive, and outbreak investigations such as in nursing homes or detention centers. When the lab reaches capacity for the day, both Montana State University and our reference lab, Mako, have been crucial partners in assisting with performing the remainder of the tests. Mako processes on average 700 to 1,000 tests per day for Montana on Monday through Friday, while Montana State University is processing around 750 tests per day on Tuesday through Saturday. MSU has assisted with some of the outbreak investigations, as well as some of our community testing events. Once a test is received at the state lab, MSU, or Mako, the turnaround time is averaging around between 1 and 3 days, depending on the priority of the sample. And again, that's once the sample's received by the lab. While not at the scale that we saw this summer, some communities have recently conducted or are planning community testing events. Last week, Busby, Muddy Cluster, and Lame Deer held community testing, collecting nearly 600 asymptomatic samples. Next week, Park County in Livingston and Gardner and Fort Peck will be holding community testing events. We'll continue to work with communities who may have an interest in standing up those community testing events. Finally, when it comes to our economic recovery, the Business Stabilization Grant Program has hit a new milestone. 9,367 small businesses have now received funding through the program, helping to keep the doors of our Main Street businesses open, keep employees on the job, and keeping bills paid. This has been the most in demand of more than a dozen grant programs set up to assist Montanans and businesses through our continued response to COVID-19. On average, a single business received about $17,000 in working capital through the program. Many businesses funded through the Business Stabilization Program reported that they had received no other grant or loan support, meaning they did not access SBA's Paycheck Protection or the EIDL programs. Data from early August shows nearly 4,000 businesses that were paid one of our grants did not receive anything or did not access the SBA programs. As Scott Hopkins of Dillon put it, without this grant, he thinks he probably would have had to close his business or seek employment elsewhere. Or as a trucking company in Roundup shared with us, the grant is the resource that kept us going from going out of business during the pandemic. The second payment of the grant brought us from a position of barely skinning by and playing catch up for a couple months to being almost as healthy as we were when we had to shut down in April. Or as an outfitter business in Essex put it, funds like this are a lifeline. And among the numerous other grant programs we've had available for businesses, small, medium, and large, and nonprofits, from business stabilization to ag adaptation to business adaptability to meat processing to loan deferment to live entertainment grants, over 13,000 businesses and organizations have received grant funding to help them stay afloat and continue to provide services in these times. I know it's becoming routine for me to, in press conferences, with a reminder to mask up, to wash your hands, and stay vigilant against COVID-19. Trust me, I look forward to the day where I'm not providing those reminders or we're not having these weekly conferences. But until there's a safe and effective vaccine, that personal responsibility remains our greatest weapon in this fight. And to be clear, when battling a communicable disease, personal responsibility is community responsibility, especially when that disease can spread without symptoms. That's why masking up, even if you aren't vulnerable, is crucial. My mask protects you, and your mask protects me. That's why the CDC is still recommending masking up. We're all hoping for a vaccine to meet the rigorous safety and efficacy standards set by the Federal Drug Administration. When there's a vaccine that's deemed to have standards in place to protect us all, it'll be public knowledge. Public health experts will be able to view the findings, and we can have confidence it'll be vetted before being distributed. Right now, no major vaccine has completed clinical trials, but our state public health department and local public health departments are no strangers to distributing and administering vaccines, and will be ready to go as soon as the vaccine is. We're preparing for large-scale vaccine distribution, working off of our experience with H1N1, adopting current vaccination plans to better fit COVID-19, and identifying partners who can assist us in raising awareness of and distributing that vaccine when it's ready. But until that time, we must continue to live in our new normal. Your fellow Montanans are relying on you to be a good neighbor. We have to keep the curve flat to protect teachers and kids so our schools can stay open. Our Main Street businesses don't have many employees. If one of them contracts COVID-19, the whole business may need to close while employees and owners are quarantined and tested. Case counts for the most recent week reflected a decrease of about 17%, reflecting a decrease of nearly 160 cases compared to the prior week. It still leaves a whole lot of room for much improvement. And that doesn't mean that next week the cases will go lower. It does underscore we need to continue to protect ourselves and protect others. Unfortunately, we still have many areas of the state that have community transmission, a situation that increases the risk for all of us. However, vulnerable individuals in these areas, especially those in long-term care and assisted living facilities, are at high risk for hospitalization and death. To date, 26 long-term care centers and 33 assisted living facilities have had a COVID-19 case in a resident or staff member. Combined, 44 or 1/3 of our state's 141 deaths have been related to these settings. Transmission in the community that occurs between people of any age contributes to the risk in these settings. The staff can unknowingly bring the virus into those places. We have to remember that each of us taking simple precautions can prevent a hospitalization or death of someone we know or someone, and because the virus can be passed so easily, someone who we don't know unless we break that chain of transmission. Any setting where a large number of people gather is certainly at risk. With the beginning of the school year, we can see this as a number of schools have been impacted. This was not unexpected, though, given level of infection in many of these communities. However, the preparation that took place before the start of the season is showing as schools that have been impacted have moved quickly to address the situation, identifying contacts, supporting testing, and working closely with public health partners to prevent further spread. Since the beginning of the school year, about 60 schools, including our universities, have reported at least one case in a student or staff member. Fortunately, in most of those instances, this represents one or two cases which were likely not acquired in the school settings. In other cases, we see some limited transmission to a relatively small number of students or staff. To put it in context in some respects, if we look at our K-12 system when it comes to students, we have about 147,000 young Montanans getting their education in the K-12 system. To date, we've had, to date, we've had, sure I get those numbers right, I think we've only had about 51 cases. So to repeat that, with 147,000 kids in our K-12 system, about 51 positive cases have been identified. Not just the cases, but then the work done afterwards, the planning and preparation that school staff went through is evident as that spread really has been limited. So I'll continue to remind all Montanans that stopping this virus, that's riding on all of us. We have to continue to protect our neighbors, and our loved ones, and our schools, and our communities. I'll now open it up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hi, Governor Bullock. This is Maritza from NBC Montana. I have two questions for you. The first is that a USA Today report out today says we're one of 21 states that don't report antigen test results or don't count antigen results as positive. I'm wondering if you or Dr. Holtzman can explain that process more and what our antigen testing system does look like.
Murphy or Holtzman?
The question about antigen test reporting, we will have that reporting here. I mean, it is in place. If we have somebody that has a positive antigen test result, we are asking the nursing homes and the hospitals that are performing those tests to report that to local public health officials. It may be followed up with more specific testing like PCR that we're more routinely performing. I think this test is now just being rolled out in some of the settings in Montana, including nursing homes. But it is indicative of a positive, and it is something that we do consider reportable in Montana.
Okay, thank you. And my second question is, there are hints that President Trump will hold a Montana rally before the election. Is that something that would need approval from a state or county level because of COVID guidelines?
Well, I think, look, that'll be, at the end of the day, probably up to the county health authorities. You know, you think that also just about every day since March, as there was also, I guess, an event earlier this week, but I've been on video calls with the White House Coronavirus Task Force, and time again I hear from the White House officials and the management that the management of COVID-19 is really on state and local authorities, and that'll be supported. So certainly hope that any large events, no matter what they are, works with local public health. Next phone question.
Hi, Governor. This is Iris Samuels with the Associated Press. I saw this week that the number of people hospitalized in Montana with COVID-19 has decreased. I'm wondering if you can give an update on why the number of hospitalizations is going down, even as active cases remain about the same.
Yeah, Iris, I think that the hospitalizations decreased. It was like 160, now it's 106. Part of that is cleanup, meaning that it's pretty easy in each of our hospitals when someone comes in, but the reporting isn't always as clean and consistent when they're coming out. So the hospitals provided the most updated information, did some cleanup on that. So I wouldn't read that as a trend of all of a sudden, you know, we're going to continue to see declining hospitalizations, especially with the caseloads, but it was more a reporting issue than it was a fundamental shift in what's happening out there in our communities. Next question.
Governor, Matt Hoffman from the Billings Gazette. With the information reported for the school database, what is that coming through? Is that reported on kind of the same timeline as the overall state database update? Is it coming directly from county health agencies? Because we've seen some discrepancies and lag there.
Doc, do you want to handle that? I mean, what we'll be reporting out is once a week. I imagine that local schools and administrators may be providing updates at other times, but what we'll do is aggregate it from all across the state and provide it every Wednesday afternoon. Yeah, go ahead if you have any. And if Doc Holzman, the Chief Medical Officer, he might have something more to add.
I really don't. That pretty much is it. We get reports in from local public health and with communications with our epidemiologist and their work in the local area. And we put that all together, and once a week we will put that out. That will give us opportunities to try to bring all that together and be as congruent as possible. But the most accurate and up-to-date data is going to be what's released at the local level.
Okay. And just to be clear, there won't be any counties or schools, except for the size limitations that you noted, that are excluded from this.
That is correct, Matt. And I'll also say, to step back a little bit, I mean, I want to give great credit to local public health and our school administrators. I think back to the Zoom orientation for one of my children, which was just 2 short weeks ago. And the principal saying that, look, we don't even know if we as the school, have the information from county health. And we had to make sure both individual patient or student information is protected, and to make sure that sort of the networks are there from local public health to the school districts to the individual schools. So I commend the folks for figuring out the ways to actually get this done, so at the end of the day we can provide this information. I mean, I think providing a quality education while protecting the health of our students, teachers, and staff demands we do everything we can to instill sort of the trust and confidence in the education community, and providing this sort of information in a way that's protective still of student or staff personal health information, but making sure that the community has that awareness, and making sure the networks are there between local public health and our schools in a building by building basis to ensure timely information can be provided is important. So I commend the good work that they've all done so that we can get to this point where we can say that statewide we'll aggregate and provide this information at least once a week. Next question.
Hi, this is Kayla Roche with Yellowstone Public Radio News. What is your plan if the state hits another spike in cases this fall and needs to be shut down again?
Kayla, it's interesting as you ask that question. I can hearken back to maybe even April, when I was getting questions, well, what do we get to do next? What do we get to do next? I think the plan is continue to recognize that this is a health challenge, a challenge that we haven't faced as a state or nation in a century. And it's an economic challenge we haven't faced in a century as well. And had said more times in more press avails that I would ever want to say that this is a rapidly changing dynamic situation. And what we'll always do is monitor where we are on the health side and monitor what we have to do to be most protective of both the health of Montanans and the economy of Montanans. So what we'll have to do is see, look, if we all do collectively the things that we need to do and that's as Montanans, we're not going to see a significant spike in our state come fall. But if there is a significant increase in cases, the decisions will be, as they have been all throughout, informed by first, public health, and second, economic impact. Next question.
Hi, this is Karen Stein from the Bozeman Daily Chronicle. I just wanted to go back to the statistic you shared about K through 12 schools so far. You said there have been 51 cases of kids out of the 147,000 K through 12 students in Montana. I was just wondering when that data was collected. When did you start counting those? And then also, how did you decide to release this K through 12 data weekly rather than daily, like the other coronavirus data we have on the state dashboard?
Well, I think there are two different things. And one, no, we've just been collecting it as we worked with local public health, because it said wanted to get this dashboard up, and it will be K-12 and it'll be our university system as well, updated at least and typically every Wednesday. And part of it, right, is ensuring, and Doc Holzman might have the local perspective. It's like, look, we want to get information that's both timely and correct. And so much of that's on local public health, more than even at the state side, meaning that I think they work darn hard to say, here's where an individual even lives in a county and their age, is that we can get along the way to be able to trace back exactly, are they in school, are they at home, things like that are that much more challenging.
I would just add that this is actually the exact same way we're doing with nursing homes and assisted living facilities. It's once a week. And the reason we have so many people that have been working incredibly hard for the last 7 months, and there's just no way that we would be able to keep it up, keep it accurate, and get out good information. And that's what's important. I mean, it's important to be transparent and get that information out, but it's also really important that the information that gets out is correct. And is giving the right information. So that's why we're doing it once a week, because we feel like we can keep up with that and get that going, and not affect by any means what's happening at the local level, where they're actually doing the investigation and figuring out who needs to be isolated and quarantined. That's going to be happening at their pace, which is a lot quicker for their jurisdiction, and then we bring it together for the whole state. Thanks.
Next phone question.
Hey there, this is Catherine Houghton with Kaiser Health News. This question circles back to how college student COVID cases are counted and recorded in our county, and also just in the state. And I think it was last week's press conference that Jim Murphy had said wherever a student calls home, that's where they're going to be counted. So I'll probably have two questions with this, but I will start off with, if a college student who contracts COVID had put down a home address, say in Arizona where their parents live, what's the state doing about that to make sure it's counted here in Montana?
Well, every case that is reported to the local health departments gets investigated, and we try to figure out what is that person's place of usual residence. We ran into this a lot, months ago, even with snowbirds as they returned to Montana. So we do have systems, in place at the local level. We don't only look at their individual address, what their legal address might be, but we look at what the facility is or the place that they sought medical care. That also drives some of that local investigation. So we're confident that an out-of-state student that is attending school in Montana is going to be counted in Montana because that's their usual place of residence. This follows the standard CDC approach to counting these folks so that we don't have duplication between different states, and so that we count people where it makes the most sense.
Great, thank you. So you don't think at this point that COVID cases are getting misassigned either in the state or outside of the state based on where college students kind of record their home address?
No, I don't think that we're having that misassignment of cases. I think, as Dr. Holtzman said, that's one reason that we try to give the local health departments a day or two to do the investigation before putting out information that needs to be corrected. Sometimes it's unavoidable, but through the process of the investigation and the contact tracing process, which also has to happen, it's pretty easy to determine fairly quickly where that person really resides, despite which address is on their medical record or something like that. So we're confident that we'll count the people in the right spot and make sure that the case investigations occur.
Got it. Thank you.
Next phone question.
Hi, this is Phil from Great Falls Tribune.
Hi, Phil.
Was just wondering, hi, how you doing, sir? Was wondering if private schools or any private schools participating in this, or are they part of the count? I was also wondering about jails. I'm getting a lot of emails from parents about trying to get their people out of jails, and they say that that the state's not releasing nonviolent, parolable, eligible folks from the jails.
Two different things: that private schools will be included in these numbers, and when it comes, our board of parole has actually done a lot of work when it comes to the releasing of nonviolent offenders, and that's where that resides or within the local court system.
Is the state doing anything to move its inmates out of the regional jails and back to state facilities? I mean, in Cascade County, the sheriff has said that he has a lot of state inmates that he wishes he didn't have to deal with in these times of COVID.
Where health requirements can, we have been. We have been doing some work with both Cascade County and Yellowstone County in that respect. Whether transfers are occurring right now because of the level of COVID positives in Cascade County, we'd have to get back to you on.
Thank you, sir.
Thank you. Last phone question.
Yes, Governor, this is Casey over at the Dillon Tribune. I've got a weird question for you. Have you or Dr. Holzman or Mr. Murphy heard about people, say at colleges or whatnot, that are hesitant to get tested because they don't want to be isolated, quarantined, all that is associated with that?
Yeah, see, I think the question was, have you heard of people that don't want to be tested because then they don't want to be isolated or quarantined? Look, anecdotally, there could be all kinds of, individuals. I mean, there's nothing in sort of a large group of people that we've been hearing about that. But that's one of the things that local public health has challenges with. I mean, at times when folks are asked to quarantine or isolate, we really urge Montanans to take those steps along the way, because as much of a sacrifice as that might be, curbing the spread is what's going to keep your campuses or your high schools or other things open. And it is one that, we continue to test close contacts of those that are positive. And would certainly encourage anyone that's a close contact or have any symptoms or reason to think to get tested, because the outcome, the adverse effects of not doing so could be a heck of a lot more than a 2-week quarantine.
Governor John Riley with Montana Television Network. We did have a high school shut down this week because of COVID. Has the state been looking into that, about how their plans might not have prevented a shutdown or actively investigated what could be done differently for other schools?
John, I think what we will continue to see with this virus in our midst, like the state, every time that a positive ends up in a school, won't be going in and doing an investigation. But what we have been doing on the front end and all throughout is both local public health and state public health will work with those educational institutions to ensure that they can do all facets of their mission, right? I mean, just because one gets a positive, like as an example, one positive case in one school, now that doesn't mean we're necessarily going to have to shut down the school for a whole week or 2 weeks. But what it means is recognizing, and that's one of the reasons why we worked with the education community and public health to put out some guidance of what to do along the way. Look, I fully anticipate, I wish I could say otherwise, but I fully anticipate we'll have more positive cases in our schools. And it's both how we can provide the information to make sure that people know about it, because parents and others are certainly concerned, but then also how we can act to recognize we're trying to learn how to live with a virus in our midst. So to take the mitigating measures and then the mitigating measures when it comes to an individual school, so that schools can do what we all count on them, and that's educate and nourish our kids. Great, thank you again. And I think as we go forward, both on the fires and COVID-19, recognize that it's on all of us. So really appreciate it, and probably see you next week.